we're going to be talking about the application of an Unna boot. An Unna boot can be used for one of a few things. One of them is typically when we have a patient with a lot of leg swelling or edema, especially if there's a chronic wound associated with it, sometimes a post-operative surgical wound on the lower leg, and we can also use it for medical purposes. We can oftentimes, if someone has bad stasis dermatitis or a rash on the leg, we can use topical steroids and occlude it with the Unna wrap on top. Or if someone has a lot of precancers, we can do a chemotherapy wrap, putting Fudex on at the base of the Unna boot and then occluding it with the Unna wrap itself. The Unna boot itself has some very particular components that are important for you to have before you get started. The base of it is going to be Vaseline petroleum jelly, Vaseline gauze or Xeroform, an Unna boot, which essentially is a zinc and pectin based wrapped gauze. Curlex, there's different kinds of Curlex. If you have a leg that's very weepy, we probably are going to use the thicker Curlex. If it's a wound where the edema or the fluid drainage is fairly low and we don't want a bulky wrap, a thinner Curlex is appropriate. On top of that, we are going to use Coban, and in the end, you have to have a pair of scissors to cut all of the components. So we're going to go ahead and start with a sample of an application of an Unna boot. The purple on the leg is just a factitious venous ulcer that we'll address. So the first thing we're going to do is we're going to start with the Vaseline. The assistant will go ahead and get that here. So you have a good amount of Vaseline. A good amount's important just to moisturize the entire leg so the Unna boot itself does not dry up and stick. Once a nice even coat of Vaseline is applied, either Vaseline gauze or Xeroform is applied to the wound itself. Followed by the Unna itself. So this is the Unna paste. The most important thing to pay attention to is how Jen is going to wrap this leg. Very subtly, she's going to put a fold into the wrapping itself, and the fold is going to allow for the expansion and contraction of the bandage. So you can see it right there. Sorry, there we go, and there's that fold. We want a little bit of overlap on top of the wound. If the overlap or that little fold is not placed, patients will often complain of pain in the lower leg, mainly because as the swelling increases during the day and that Unna wrap is not able to expand, it can become uncomfortable. So once the Unna is placed, after that we have two different kinds of Curlex that are wrapped. If the wound itself is does not have too much drainage, we can use the thin Curlex. Fantastic. And for the final component for the compression, the Coban. For the Coban, the amount of tension that is applied is extremely important. We do not want the Coban applied too tight, but frankly it should be a little bit loose because during the day it will automatically tighten up on its own. Once that's done, a few things can be done just to improve patient comfort. One of them is a small cut at the top just to allow for swelling, and sometimes at the bottom as well. And there we have a basic Unna boot application. When the patient returns, it's important to know how to remove the Unna boot for a new application. We do have a pair of scissors here. We're typically not going to unwrap it. That's a little bit inefficient. Most important thing as you're cutting the Unna boot off is to make sure that we are not cutting in line with the wound or the ulceration. After this, typically we will clean the leg, evaluate the wound, and oftentimes, for not achieving our goals, reapply the Unna boot. Thank you.